Okay, so now let's talk about the movements of the rib cage. We're not going to go into a lot of depth right now because we'll be discussing this in more detail in a later video. But this is just an overview. So the movements are permitted at the costovertebral, costotransverse, and manubriosternal and costosternal joints. So that's 4 different types of joints. Let's write them down. So the costovertebral joints, they're talking about this joint here. And then the costotransverse joint, this joint here. The manubriosternal joint, this joint here. And the chondrosternal joint, this joint here. When we talk about these movements, what happens is we're saying that during inspiration, the ribs rotate superiorly on their costovertebral joints and the sternum moves anterosuperiorly. This causes expansion of the chest cavity. So this basically rotates like this. Or from here, I'll show you. This rib rotates like this. And this basically lifts upwards like a bucket handle. And when that happens, the sternum, this part of the sternum, it moves up like a lever. So this is during inspiration. So during inspiration, we want the chest cavity to expand. So what happens is the transverse diameter increases, allowing for more air to come into the lungs. So what happens when we expirate? Now, the ribs rotate inferiorly. So the rib is rotating inferiorly. At this joint and at this joint, it's rotating inferiorly. Just like a bucket handle. So now the bucket handle is going down. This decreases the transverse diameter, making it easy for the air to come out. As the pressure increases inside, it comes out of the airways. The air moves out of the airways. And the same way, the lever movements of the sternum, they now move downwards. This causes the reduction in the size of the chest cavity. So just to review our movements, during inspiration, the ribs move upwards like a bucket handle, and the sternum moves up like a lever. This is to expand the chest cavity. And during expiration, we have the opposite. The ribs move downwards, and the sternum moves posterior-inferiorly as well. And the ribs move inframedially. This, again, so the ribs are now moving down like a bucket handle, and the sternum is now moving infra-posteriorly like a lever during expiration. Okay, so when we look at the movements of the infant, as you can see, here's the transverse section of the thorax of an infant, and here is the cross-section of the thorax of an adult human being. So when we look at this, we can see that the infant's thorax is more circular, and the adult's thorax is more oval-shaped with regards to the transverse diameter. The transverse diameter is this way. So what's important when we look at it from this perspective? What we need to understand is that the child or the infant, their ribs are more horizontal, whereas in the adult, the ribs are more oblique. So the adult's ribs move like this, whereas the child's ribs are more horizontal. So what effect does this have on the chest movements? In the child, we will see that the respiration is more abdominal. So this is called, in babies, you will see, especially in newborns, it's very easy to see that they have purely abdominal respiration. Whereas in the adult, the ribs also move outward, they expand, and the sternum moves outward. So we have abdominal, and the abdomen also moves in and out with respiration. So what will happen is, just imagine this is the back, and this is the back of the child. So in adults, the abdomen moves out and in during breathing. But in the adult, the rib cage also moves. So this is called thoracic respiration, and this is called abdominal respiration. So in the adult, we have abdominal thoracic respiration. And in the child, we only have abdominal respiration. This is significant because sometimes in some patients, in different conditions, an adult patient may present with only abdominal respiration. So that's it for the movements of the thorax. We'll be going into a little bit of more detail later on in future videos, talking about what muscles are involved in the movements and how they help expand the chest cavity.